neonatal sepsis. Is it clear? Now, in late onset neonatal sepsis, generally the sepsis in this case is going to have a point of focus. Is it clear? You have a sepsis with a point of focus. In case of early onset neonatal sepsis, there is no need to check for the point of focus because it is usually coming from the mother. The child has not yet been exposed to the environment to have a point of focus. Is it clear? So the child has passed through the birth canal, and it is the infections is the microorganism in the birth canal of the mother that have resulted to the infection of the child. Is it clear? So now let's visualize now the point of focus inside late onset neonatal sepsis. So now for the point of focus in late onset neonatal sepsis, the pathogenesis is that the microorganism can either come from different routes. The first route can be we start from up to down. Is it clear? We can have the respiratory tract. Is it clear? You have a respiratory tract. Is it clear? Generally, you can have upper respiratory tract and you have also the lower respiratory tract. But you need to know that most of the time, it is the lower respiratory tract that results to sepsis. But there are certain cases where the upper respiratory tract also results to sepsis. Is it clear? Because you need to know that there are certain areas which are highly perfused, like the pharynx. Is it clear? The pharynx is highly perfused. Is it clear? So in case where you have a pharyngitis in upper respiratory tract, or you have also otitis media or otitis interna, you can have also infections. Is it clear? There are cases where you have upper respiratory tract infection which can be associated with infection. But most of the time, the upper respiratory tract infection is not associated with any fever. Is it clear? We have rhinoritis, which is inflammation of the nasal mucosa. You have glossitis, you can have tonsillitis, you can have pharyngitis. So those are the different. You have also laryngitis. Is it clear? But in upper respiratory tract infection, there are certain cases where you can have fever, or you can have also sinusitis in the case of upper respiratory tract infection. Now, cases where you have fever is when you have organs which are highly perfused with blood vessels. Is it clear? And these organs in the respiratory tract are highly perfused with blood vessels. You have the pharynx. So in cases where you have pharyngitis, you may have fever. Is it clear? In case where you have pharyngitis, you have also the larynx. So in case where you have laryngitis, you can have fever even without the patient having a lower respiratory tract infection. Now, so that is the element that you have to bring on the upper respiratory tract infection. So I'm going to explain you on the clinical presentation how you can evaluate for the upper respiratory tract infection. Now, for the lower respiratory tract infection, it is in a case where you have infections now of the bronchioles, the bronchi. Generally, you have to know that what the upper respiratory tract is the larynx, the pharynx is starting at the level of the larynx, it's upper respiratory tract, but lower respiratory tract can start at the level of the trachea, is it clear, and downwards. So the trachea, the true bronchi, we have the bronchioles, and then we have the long parenchyma. That's the lower respiratory tract. Is it clear? So in physical examination, I'm going to tell you the elements that you're going to visualize in lower respiratory tract infection. So after respiratory tract infection, we can have also another point of focus, which can be the umbilical cord. The umbilical cord. So you need to know that the umbilical cord falls within 4 to 7 days, or usually falls between 4 to 7 days of life. And if it is not well cared with proper hygiene, that is just cleaning of the umbilical cord, just cleaning of the umbilical cord with water, and then exposing the umbilical cord out of the part of the child. You have it so to prevent exposure to feces. You don't have any infection. But if the hygiene care of the umbilical cord is not properly done, you can have infection of the umbilical cord, which is going to be called an inflammation of the umbilical cord, is going to be called omphalitis. Is it clear? And it's going to be a point of focus via which you can have sepsis or septicemia of the child. The next element, you have to know that there is urinary tract. Generally, the child cannot tell you that he has irritative urinary symptom. The only element that can tell you that the child has irritative urinary symptom is if the child has a macroscopic hematuria. Is it clear? The things like dysuria cannot easily be visualized in the child because they are 4 major elements that make the child cry. Is it clear? We have feces. Is it clear? You have food. that the child should take food, he can cry. Then you have illness, is it clear, or fever, is it clear, can make the child cry, or you have also urination. So those are the elements that makes the child cry, is it clear. So if the child is urinating and is having actually dysuria, you may not know if the child is crying because he has urinated on himself, or the child is crying because of the dysuria. So the dysuria is not a typical element to know in a case of a child. So every time that you have a child with late onset neonatal sepsis, it's always good to do a urinalysis. Is it clear? When you have a late onset neonatal sepsis, it's always good to do a urinalysis to visualize if there are leukocytes, and you also visualize if there are leukocyte microorganisms. You may also do the culture. Now, after that, you have to visualize the skin, the integumentary system. Is it clear? You may have rashes in the child that affects the integumentary system, which can be another mode of point of focus in the child. Is it clear? And the last point of focus is a gastrointestinal tract. Is it clear? You need to know that the child that's why it is best for the child to receive breast milk, and the breast hygiene of the mother is very good, because if the mother is not wiping her breast very properly, you can have Staphylococcus aureus and other microorganisms can shift from the breast into the GI tract of the child, resulting to infections. Is it clear? So those are the elements in the GI tract. You can have also another point of focus for the child. Is it clear? So another element where you can have GI tract is when the child is not receiving exclusive breastfeeding. The child is receiving instead artificial feeding or mixed feeding. Mixed feeding is when the child is both on exclusive breastfeeding and artificial feeding. Why? When the child is both exclusive breastfeeding and artificial feeding, but when the child is only on artificial feeding, say that it's artificial feeding on artificial milk. Is it clear? So those are the different pathogenesis for the early onset and the late onset neonatal sepsis. Now we move on to the next point, which are the causes, the microorganisms involved in the early onset and late onset neonatal sepsis.